veterans in the audience as well as new ones. So I can talk about this for Britain. I've got 15 minutes, so I will try to get through my slides in rapid time. But as Sally said earlier, the slides will be on the website tomorrow, so if you want to use any of this information, you're very welcome to after today. So this is my key performance indicator slide. I have to use it in every presentation that I do, but I'm hoping that what CQC is here to do is familiar to you all. We are here to make sure that health and social care services provide people with safe, effective, compassionate, high-quality care, and very importantly, we are here to encourage services to improve. And it was fantastic to hear Chris talk this morning about innovation, and you'll notice a couple of times in this presentation that innovation is indeed an important part of encouraging services to improve. So that may be my key performance indicator slide, but this is the one that I prefer because it translates that purpose into the humanity of what we are all here to do. And that is to make sure that the services that we are regulating, that people are using, that people are providing, are good enough for the people that we love. And I call it the mum test. This is indeed my mum. She's looking pretty happy in this photograph because it was taken on my wedding day. It had taken me 17 years to get David to marry me, so she was pretty chuffed when I pulled it off. So we're asking 5 key questions to find out what matters to people when we're looking at services, to understand whether they do meet the characteristics of good or whether they stretch to outstanding. So asking whether it's safe, asking whether it's effective, does it do what we're expecting it to do to support people? Is it caring? Are we treating people with the dignity and respect that they have every reason to expect to have? Are services responsive to people's needs? This is particularly important in adult social care. We provide services to people, particularly if they're living in residential settings, every single day of the year for the rest of their lives, and we need to make sure that we are responsive to their changing needs and that happens in an appropriate way. And we absolutely know that underpinning all of the ability to deliver services in this way is good leadership. Leaders who create a transparent, inclusive culture that welcome families, friends, carers into the service, listen to what they say, listen to what the people who are using those services say, and actually make a difference in terms of supporting their staff to be capable and confident of delivering the good care. So, is this a service that's good enough for my mum or anybody else that I love? And if it is, that's fantastic, and we should celebrate it. But if it's not, we have to do something about it. So one of the things that CQC does every year is make a report to Parliament on the state of care. And that's the state of care in health and social care. And I know many of you will be interested in some of the statistics around the health service, but I am going to focus, as you might imagine, given my job title, on the things that we identified for adult social care. And this was published last October, and we identified some good news. You might be forgiven for thinking, if you've been reading the papers recently, that there's no good news in adult social care, but there is. Many services are indeed providing good quality care, and at that point it was over 70%, and that persists today. Where we had identified services as being inadequate, when we went back, 3/4 of them had actually improved, which is really, really important. And we were seeing some very good results, particularly in community and social care locations, including services like Shared Lives. And caring, that question about whether the service is caring, whether people are being treated with dignity and respect, was coming out very strongly as the highest performing question. And one of the things that I think that reflects is what a fantastic bunch of staff we've got who are dedicated and committed to providing services in the best possible way. And sometimes, sadly, they are doing that despite the system that's sitting around them, and we need to change that so that they're able to provide that care consistently into the future. But unfortunately, we also identified some worrying news in the state of care last year. About a quarter of services were requiring improvement, so they were not reaching that benchmark that I would expect my inspectors to use, that they would walk away and say, yes, I would be happy for somebody I love to use this service. They needed improvement to get to good. And 2% of services were inadequate. And frankly, if you want to have nightmares or you enjoy horror stories, read some of our inadequate reports. Some of the circumstances in which people are being supported and cared for is just utterly unacceptable in 2017. We saw that there was poorer performance in terms of our focus on safety and leadership, which I think points to the areas that we need to work together to improve. And although there was significant improvement in the inadequate services, a quarter of them didn't improve. And that is something that is very worrying, and particularly worrying for me is that those services that we rated as requires improvement, over half of them weren't improving. And that, I think, we need to really examine in terms of our next phase of work as to how we can encourage and support those services to improve. So just to bring the state of care up to date, this is January 2017, and as you can see, we are still finding the vast majority of services are good, but the percentage of inadequate services is increasing to 4% at the current level. And I think that does show some of the pressure that there is in the adult social care system, which I'm sure David will touch on in a minute. We're still seeing that caring is coming out as the best performing question, but we're also still seeing that safety and leadership are the areas that we have the greatest worries. And in terms of the service types, where is the good care across the different types of service? Community social care is coming out as the strong performer, followed by domiciliary care services. So in terms of focusing on living life well in a community, there are some very good services that can help people do this, but we also have some problems, particularly in nursing homes, mostly associated with the difficulty recruiting and retaining good quality nursing staff. And interestingly, by size of domiciliary care agency, we are seeing that the smaller services, where it is possible to focus on the person, to focus on the relationships, as Chris quite rightly identified, that's where we're seeing some of the best activity. But we can focus on the things that are not going well and learn from those. But as I think we were inspired to, by Chris earlier, we can also think about the things that are going well and what can we learn from those. And so this is a synthesis of some of the key characteristics of the outstanding services that we see. And there is so much in this, which I could talk about this slide for the rest of the day. But crucially, people are at the centre, and staff want them to have a life. It's not just about a task or a service. It's about supporting people to have a life. There is great leadership. There's a transparent, open culture available to people. The words that Chris was using so regularly, creative, innovative, those are the sorts of services that we see that are outstanding. And one of the most important aspects for me, and I visited an outstanding service last Friday, is that the services that we have rated as outstanding, they're not resting on their laurels. They want to improve. They are seeking that innovation every single day. And last but certainly not least, the focus is on the people who are using the service and not the regulator. People who get an outstanding rating are doing it for the people that they are supporting. They're not doing it to get an outstanding rating from the regulator. They're doing it because what they're doing is the right thing to do, and they're focused on that. So these are just a couple of quotes that I've drawn out from some of our outstanding care services, which, as you know, the slides will be available for you tomorrow, so you can read those at your leisure. But what's really coming through in these quotes is the real focus on people and how we can make sure that they are supported and able to live their lives well in the community, connected to the community in a way that is really meaningful. But unfortunately, as I said, the headline news is focusing very much on some of the problems and the issues that we've got in adult social care at the moment. We've already heard a tipping point being used this morning in the most beautiful quote ever, I think, about the bud and the blossom. But we identified in the State of Care report in October that we felt that adult social care was approaching a tipping point. And we assembled an awful lot of evidence, not just our own, but looking at what Age UK had said about the levels of unmet need there are for older people, the reduction of support from local authorities, the fact that we know that there is increasing demand, and particularly increasing demand for people with very complex needs, but some of the provision for that demand is now starting to stall. We can see providers handing back contracts to our local authorities because they don't feel that they can deliver the care in the way that they would want to. And we know how difficult recruiting and retaining good quality staff is in adult social care. Yes, the national living wage is a very welcome development, but it wasn't the national living wage just for social care. It was for everyone. So those comparisons still exist in terms of people being able to do other jobs at that same level. So we've still got to think about how can we get the right people, keep them, and ensure that they're able to do it. And this is just an example, one of the slides that we used last year around the delays in discharges from hospital beds. And the arrows are pointing out that the delays that are caused by waiting for nursing home places, residential places, and crucially the yellow one, which I pointed out, is packages of care in the home. So for me, the system is failing the long test. It's not just individual organisations battling. We've actually got to see this as a whole system issue and that we need to work together to improve. And to do that improvement, it takes a collective effort. There is a lever to pull, which is regulation, and the present government and the previous one has used that regulatory lever quite a lot. But it cannot and can never be the only way that we get quality services. If you're relying upon me and my inspectors to pitch up and work out that things aren't working very well and what needs to be put right, it's way too late. We need to be doing it by listening to the public, listening to people who are using services, their families and their carers. We need to make sure that staff are capable, confident and supported to do a good job. Providers need to be thinking about the culture, the organisation, the expectations that they set for their services, for their staff. And commissioners and funders have to have high expectations for quality and really respond to that responsibility that they've got. And regulators, of course, we need to play our part, but we need to play our part with that system working together. I'm still not entirely convinced by this picture, but somebody cleverer than me will probably work out eventually what's the best way to show this, which is making sure that we have person-centred, high-quality care for all, which is safe and effective, does give people a good experience, is well-led, is supported by sustainable resources, and brings the adult and social care service together with healthcare, wrapped around the individual, because people do not live their lives in the individual silos of health and social care. They live their lives in an integrated whole, and we need to think about it. So CQC is making a commitment to be a part of moving this forward, working across the national system of health and social care, which is so important. We're going to be talking about new models of care later today, and we can see lots of different structures growing up that we need to be thinking about how we can work across the system to support. We need to be encouraging that improvement, that innovation, and picking up on some of the great ideas that Chris was sharing with us earlier. having a shared view of quality that actually truly does respond to the wishes of people who are using services, their carers and families, but is shared by commissioners and providers as well as the regulator, is so important. And it has got to be not just about words, it's got to be about practical things that make an obvious and tangible difference to people, and so that is the way that we need to be taking things forward. And finally, in terms of thinking about what can others do, if I'm saying that it can't just be the regulator, we've got a part to play, we have to do that. But we need to make sure that commissioners are playing their part, that there is better coordination between health and social care. I could wax lyrical about some of the problems with some of the sustainability and transformation plans, and I'm sure David and others might do that as well. We've absolutely got to invest in good leadership. We can see the difference that a fantastic registered manager makes to an individual service. And we've got to think about how we invest, recognise and value that. In adult social care, we don't have the best of improvement infrastructure available to people, and I think we've got to do something about working with colleagues like Skills for Care and the Social Care Institute for Excellence, as well as those of you in the voluntary community and social enterprise sector, to actually improve the services that are available. And I do think that we've got to raise the profile of adult social care. We're not just here to be the handmaid into the NHS. Adult social care has a role that has an intrinsic value all of itself, which can transform people's life for good. But if we don't get it right, it can be absolutely devastating. So we need to share that responsibility and live up to the promise that we're all making to the citizens of this country. Thank you very much.